it can get overwhelming kind of trying to figure out, well, what is the right type of therapy, right? So first things first is kind of starting with a therapist in identifying what the problem areas are. And then there are a series of different types of approaches. So cognitive behavioral therapy, or CBT, is something that's commonly used. So typically that's a type of therapy that tackles basically types of thinking or behavioral changes related to depression, anxiety, trauma, etc. And so trying to tackle things like automatic thoughts that pop into your head. You know, you might be doing something and then you might suddenly get a thought that I'm going to fail at this, and basically cross-examining how valid those thoughts are. Then there are types of things such as dialectical behavioral therapy, so DBT. Basically it's trying to teach individuals that think in very black and white. So can somebody be angry with me and love me at the same time? And trying to bridge that notion that two seemingly unopposed truths could be true at the same time. There are interpersonal type therapies where you're sort of dealing with transitions or grief, or how your relationships factor into the way that you feel or how you approach them. And then there's psychodynamic therapy sometimes, which is basically, in a nutshell, why do I think the way that I do, right? There's also things like EMDR, so eye movement desensitization reprocessing. So it's essentially a therapist inducing rapid eye movements while you're addressing certain traumas or anxieties, and sort of from a neurocircuitry standpoint, reframing how you experience those. And so it can be very good for trauma, for example. So many approaches, many different names, but these are just a few.